What if your injuries could heal without drugs or surgery? Or what if your body held the key to ending your pain through its own natural healing ability? Today, I'm sharing information with you about a breakthrough treatment that's helping thousands of patients recover from injuries and chronic pain without surgery, without long-term medications, and without the lengthy downtimes of traditional treatments. It's called PRP therapy, and it could be the natural solution that you've been searching for. Hi, I'm Dr. Vic. I'm a licensed naturopathic doctor who's been in practice for over 20 years. If you're dealing with pain or injury, but you're feeling frustrated with the results you've been getting from conventional treatments, or you're concerned about the risks of cortisone shots and surgery, you're in the right place. In the next few minutes, I'll explain how PRP uses your body's own healing mechanisms to repair everything from arthritis to back pain. I remember my first PRP treatment that I did on a patient was in 2005, over 20 years ago. And the patient was a professional mixed martial arts fighter, and he came to me and he said, "Doc, I've got to fight in a month, but I just injured myself today." And I looked at his knee and it was pretty swollen. And I said, "Well, I think we can get this better in a month." And he turned around and he looked at me and he said, "No, I fight in a month. I needed to be training yesterday." So I had just learned about PRP therapy and we decided to go ahead with it. And thankfully it was successful. He was able to fight, he won. And that was the first of many success stories with PRP treatment over the last 20 years. And patients range from professional athletes to people in their retirement years who want to be able to walk on their European vacation, to other people who want to avoid joint replacement surgery. So PRP has had a lot of successful results. A lot of conventional treatments focus on masking pain symptoms or reducing inflammation temporarily. And while these approaches can provide relief, they don't address the underlying problem. Cortisone shots, while effective for pain relief, may actually weaken tissues over time. And long-term use of pain medications can also come with negative side effects. This is where PRP therapy offers something fundamentally different. PRP stands for platelet-rich plasma. Instead of introducing foreign substances into your body, PRP uses your own blood. It harnesses and amplifies your body's own natural healing ability. Think about when you get a paper cut. Your body immediately begins a built-in sophisticated repair process. PRP therapy essentially supercharges this same natural mechanism. So let's look at how PRP works. Your blood contains remarkable healing cells called platelets. They're like your blood's team of repair specialists, gathering natural growth factors and signaling molecules that organize tissue healing. When you have an injury, it's the platelets that rush to the scene to start the repair process. To really understand why PRP is so valuable then, we need to understand why some injuries can be so stubborn to heal. Think about when you get a paper cut on your finger. Within days, it's completely healed. But a meniscus tear in your knee, that could take months or may never fully heal on its own. The main reason for this difference has to do with blood supply. Your skin is rich with blood vessels, bringing a constant flow of healing cells and nutrients to any injury. But joint tissues like tendons, ligaments, and cartilage are what we call avascular. They have a very poor blood supply. So imagine your body's blood vessels like a city's road network. Your skin is like downtown, streets and delivery routes everywhere, making it easy to get supplies wherever they need to go. But joint tissues, they're more like remote areas with few roads, When there's damage, your body's healing cells have a hard time reaching the injury site. This is particularly true for things like a meniscus in your knee, cartilage that cushions your joints, tendons like your Achilles tendon, and ligaments like the ACL in your knee. This is why a lot of joint injuries turn into chronic problems. Without good blood supply, your body's naturally healing cells simply can't reach the damaged area in sufficient numbers. Now, this is where PRP therapy offers a unique solution. Instead of waiting for healing cells to find their way to the injury through limited blood supply, we're taking those powerful platelets and growth factors and delivering them directly to where they're needed most. It's like airdropping supplies with a helicopter straight to the construction site. When we inject this concentrated healing solution precisely into the injured tissue, those platelets also signal your body's stem cells to help regenerate damaged tissue. This is particularly valuable for treating meniscus tears that won't heal on their own, chronic tendon problems like tennis elbow, ligament injuries that have become chronic, and even early osteoarthritis where cartilage is wearing down. With PRP therapy, we simply concentrate these natural healing components from your own blood. We collect a small blood sample similar to a routine blood test, and then use a specialized centrifuge to separate and concentrate your platelets. Because this is your own blood, this creates a natural healing solution that's uniquely yours. When we inject this concentrated solution precisely where it's needed, we're essentially telling your body, focus your healing power right here. And because we're stimulating your body's natural repair mechanisms, it is actually healing the injury. That's why PRP therapy tends to result in more complete and longer lasting relief than with solutions like cortisone shots that just mask the pain temporarily. Because PRP stimulates tissue growth and repair, it has shown promising results for various conditions, including tendon injuries that haven't responded to other conventional treatment, joint pain from osteoarthritis, sports injuries, chronic back pain, and even in some cosmetic applications like hair regrowth and facial rejuvenation. Many patients choose PRP because they want a treatment that promotes actual healing and not just symptom relief. They want an alternative to surgery or long-term medication use. They want a solution with minimal risk since it uses their own blood. And they just want a more natural approach to recovery. And what makes PRP particularly appealing is that it's not about suppressing your body's natural processes. It's actually supporting and boosting them. There's no risk of rejection since we're using your own cells. And unlike cortisone shots that may provide quick relief but can weaken tissues over time, PRP supports long-term tissue health and healing. Remember, PRP relies on your body's ability to heal and grow tissue. So there are a few things to keep in mind before and after your PRP treatment to make sure you get the best results. A couple weeks before your PRP treatment, you'll want to consider temporarily pausing medications that interfere with platelet function. Remember, those platelets are the key players in this healing process. Common medications to avoid include aspirin, ibuprofen, and other anti-inflammatory medications. These actually work against what we're trying to achieve. During PRP therapy, we actually want a useful inflammation. It's a crucial part of the healing process and for tissue repair. After your treatment, your body will be working hard to heal the treated area. For the first 48 to 72 hours, you'll likely experience some soreness. And this is actually a good sign because it indicates a healing process is actively occurring. During this initial period, avoid ice on the treated area. Heat's okay, because remember, we want that natural inflammatory response. Avoid strenuous activities that might stress the treated area, but gentle movement is encouraged to promote blood flow. Stay well hydrated to support your body's natural healing processes. Get adequate rest because deep sleep is when most of your body's repair work is happening. After the first few days, you'll gradually return to normal activities, but follow your doctor's rehab protocol for your specific situation. This might include physical therapy or specific exercises designed to optimize your healing response. While complications are rare with PRP, you should contact your doctor if you experience symptoms like severe pain that's beyond the expected post-procedure soreness, signs of infection like fever or unusual redness, or any other symptoms that concern you. The best results come when we combine PRP with appropriate rehab, giving your body the right environment and stimulus to heal properly. This comprehensive approach aims to restore function and not just mask symptoms. Following these guidelines will create the optimal environment for your PRP treatment to succeed. Think of it as making an investment in your healing process. The better you follow these protocols, the better your chances of achieving the results you're hoping for. If you're seeking a natural solution for pain or injury, and one that works with your body rather than just suppressing symptoms, PRP therapy might be right for you. It's not a quick fix. Healing does take time, but for many patients, the lasting results are well worth the wait. Thanks for watching. If you're interested in learning more about natural health tips and treatment alternatives, hit that like button and subscribe for future videos on more natural health treatments. Share your experiences or questions in the comments below, and remember to consult with your doctor about your specific situation.